working in Beverly Hills and in Hollywood and working with so many stars, it was a time that everybody of the celebrities want to have the teeth as white as they could. But now everybody on their uncle wants to have whiter teeth, whiter, whiter, and whiter. But what do you do when the white that you have in your teeth is not enough? I'm lucky to have patients ask me, I don't think my teeth are extremely white. I wish I can do it whiter, but there's consequences of that. Because if you want white, 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 you are crossing a very, very dangerous line between keep your teeth healthy or start destroying your teeth. So how do you call to this obsession so big? Even in the younger generations, and the younger they are, they want it whiter and whiter. Guess what? This obsession is called bleachorexia. As an endodontist, I see every day in my private practice patients asking me, how can I have my teeth whiter and whiter and whiter? And I have to explain to them, as I told you, you're crossing a very dangerous line between looking for perfection, because they want perfection, and looking for destruction of your entire teeth. How do we know we are so addicted to have the teeth whitening and whitening? How do we know we suffer from bleachorexia? Today, we're gonna talk about that topic that you are never gonna forget. What is the meaning of bleachorexia? It's that compulsive need to keep your teeth whiter and whiter and whiter, and it's never gonna be enough how white they are. But remember this, the abuse of peroxides, because I see this every day in my office, abusing the peroxides to bleach these teeth, because it's one of the main components of these bleaching materials, is gonna start demineralizing not only the enamel, the dentin, because our teeth naturally, they're not like white, 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 the way the people ask. They're a little under the white and beige, a little darker. And with time, when we don't take care of them, they start getting even darker. But we just need to have brush and floss, because if we demineralize from that obsession, the enamel and then the dentin, the patient is gonna affect the pulp, which is a vital tissue, and the patient start having symptoms and pain, and now we'll have to do a root canal. It's not only the root canal, there is a restoration if it's in the front teeth and a crown. So how do we gonna avoid to be addicted to this bleachorexia? How do we know we have this addiction? We're gonna see it right now. I'm gonna give you the 3 important warnings that you're gonna know how you are affecting your teeth because you're bleaching them too much. The first sign is a hypersensitivity. That hypersensitivity can be to cold, drinking a coffee, or simply just like you want to inhale air with your mouth and it's so cold the air that your tooth hurts. That means the enamel, which is compacted, now has pores and is not having the ability anymore to protect the dentin and of course the pulp, which is the nerve, the vascular system inside your tooth. What is the second warning that I can tell you? One is when your teeth start looking like translucent or really glassy, and then you look at that person, it's so white, but it's not white of whiteness, is that this person is losing all the protection of the enamel because it's getting demineralized, it's getting affected by the excessive use of the peroxide. So that's your second warning. When your teeth are like this, you are already destroying your natural teeth. What is the third sign? When you have irritated gums or receding. Let's say this gum line is down, so it's receding, or the gums are so irritated that you cannot even touch it because they start bleeding. And that happens when it's been such an amazing, incredible amount of peroxides being used over and over and over that our tissues start getting damaged. And when you see a recession and the gum is going down, now the problem is more serious because these solutions not only damage the tooth, the enamel, but also they're gonna damage our tissues. So be careful because this is the third sign that you really have to rush to see your dentist. In most of the cases, what happened is that the tooth start dying from inside out, even if it was the aggression was from outside. Now start dying from inside out, and that's when the tooth is gonna have a necrotic pulp eventually, and it's not gonna be worth it. At that time, I'm gonna tell you, I love to have my patients happy, achieve the aesthetics that they can. We have Dr. Vijak at the office. He takes care as a prosthodontist of all the aesthetic work together with a lot of my dentists that I work. And what is happening is that we ended up doing the root canal, and we want to save you from losing your tooth. I will do my best to save the teeth, but never against your health. If your health is being affected because you want a wider teeth, I am not gonna advise you to do that. So that is why you have to listen to all these warnings that I give you in order to protect our vitality of this nerve. Don't fall into the trap of home remedies, or the friend of a friend told you, my neighbor did this, the person did that, or I went to the internet and they said to do this. Don't do any of this without the supervision of your dentist or a dental professional that will guide you to avoid excessive whitening. Because excessive whitening is not even nice. It's not even funny. It looks bad, it looks translucent, it looks the teeth start getting porous, and they start losing the beauty of your smile. So don't do that without the supervision, because a white tooth, it's not beautiful, like white. Because our healthy teeth, our normal teeth are a little like a white, a little beige. We should never have it like white, translucent. So avoid that, because if you start having, like the first warning, a little sensitivity, a little pain, you have to go to see your dentist, because you have to stop the procedure right away, immediately. In our office, Dr. Frank Vijak, who has the patients for whitening of the full mouth, because I only do one tooth at a time, because the bleaching that I do as an endodontist is to create a whiter tooth when it's black due to a pulp injury. The nerve is dead. But in the case that the dentist is doing your bleaching and you have the sensitivity, we at the office give them a tray for the bleaching, but also they stop if it's hurting, and they have to use it. I think the solutions have fluoride, and the patient has to use it for a while until the sensitivity is gone. But don't abuse it, because you're gonna end it up in a root canal. I'm Dr. Fanny Yacaman, and if you like this episode, if you see or know someone that is so obsessed with whitening the teeth that is gonna end up losing the teeth, you may be able to save it with this knowledge that we're giving you. I hope you like this episode. Put a like or subscribe to the channel.